reason that I would.
Okay. Great. 4. All right. I'd like to call the meeting of the Quality and Safety Committee to order. Will the Secretary please call the roll?
Director Kim? Director Sorrell? Present. Director Stain is absent. Chair Bott?
Here.
And for the record, Director Harrington?
Present.
You have a quorum.
Great. Thank you. Good morning, everybody. Great to be with you all. The next regular meeting of the committee is scheduled for Friday, July 24th, 2026 at 9 a.m. The next item is public testimony. As a reminder, written testimony will not be read into the record, but we include in the official record of this meeting posted to the website. Madam Secretary, do we have any speakers registered to provide in-person or virtual oral testimony or submitted written?
We do not not receive any registrations nor any written testimony.
Thank you. We'll start with our first action item. Dr. Lawrence Smith, Chief Medical Officer, will now review the proposed Georgia Hospital Division Chair initial appointment.
Good morning, Director.
Good morning.
Good morning. This morning, I'm coming to respectfully request approval for initial appointment for Chair of Division of Hematology Oncology, which is under the Department of Medicine, Dr. Shweta Gupta. Dr. Gupta attended medical college in Nagpur, India. She actually did her training all at Cook County Health, including her internal medicine residency, chief medical resident year, as well as her fellowship in hematology oncology. She joined CCH first in 2009, and again, this is for an initial appointment for the chair of the Division of Hematology Oncology.
Thank you. I'd like to entertain a motion to approve item 3A, the one proposed Georgia Hospital Division Chair initial appointment.
So moved.
Motion been made and seconded. Is there any discussion on the motion? All in favor, say aye.
Aye.
All opposed, say nay. Ayes have it. The motion carries. Thank you, Dr. Smith. Next item are EMS and MEC reports and action items. Dr. Petronikos, Georgia EMS President, Dr. Alfredi, Provident Hospital MEC President will present their report and proposed medical staff action items for the committee's consideration.
Good morning.
Morning.
Good morning.
So first, just want to add, is there any questions for the reappointments and appointments that you guys should have received for credentialing? If there's any questions.
Any questions from me?
Okay. In terms of follow-up and in terms of what the EMS is doing, currently we're working on revising our bylaws, and the work group is going to be restarting in July in order to do that. And then we're also actively pursuing some physician engagements with Nicholas Shields. This Saturday, we're participating in a blood drive for one of our former EMS presidents who passed away, and we're doing a blood drive by the Marina, and a lot of the physicians are participating in that as well.
Thank you. Dr. Petronikos, I have one other question on the JSH, the
Yes.
Georgia reappointment. Is this, there are quite a few this time around, is that just consistent, or there is something?
For reappointments?
Yeah.
So I think the reappointments are occurring a lot during this time because we're hiring a lot during this time because that's when the residencies finish, and that's why you're seeing a little bit more than normal.
That's what I figured. Yeah. Okay. Dr. Allegretti. Good morning.
Good morning, everyone.
Good morning.
Morning.
The centralized credentialing committee met in May and approved the appointments to reappointments that were submitted on a document. The Provident Medical Exec Committee approved those on June 5th, and I'm here to ask your approval and available for any questions or comments.
Any questions from the committee? All right. Thank you, Dr. Allegretti.
Thank you.
And are there other activities happening that? Oh, all right. Dr. Allegretti, I was going to say, are there other activities happening you wanted to lift up at all for the medical?
I'm sorry, other activities?
Anything else going on?
No, nothing else to report from the president. Thank you.
Thank you. So I'd like to entertain a motion to approve item 3B, Georgia Hospital and Provident Hospital medical staff appointments, reappointments, and changes.
So moved.
Motion's been made and seconded. Is there any discussion on the motion? All in favor, say aye.
Aye.
All opposed? Ayes have it. Motion carries. Minutes of the May 15th committee meeting were approved by the board in May, but they're being presented today for the committee's acceptance. Are there any corrections or revisions need to be made to the minutes? Okay, I'd like to entertain a motion to accept item 3C, the Quality and Patient Safety Committee meeting minutes of May 15th, 2026.
So moved. Second.
Motion's been made and seconded. Any discussion on the motion? All in favor, say aye.
Aye.
All opposed? Say nay. Ayes have it, motion carries. Right, thank you. We'll now receive the regulatory updates, which will be reviewed by Raji Thomas, Chief Quality Officer, and Jessica Capenas, Director of Quality, Regulatory, and Staff in various facilities, and we'll focus on patient community member experience data and updates as well.
Good morning, everyone.
Good morning.
Donica Austin Cathy, Chief Hospital Executive for Stroger.
Joseph Capenas, Director of Quality and Regulatory Affairs.
And thank you for the opportunity to share a regulatory update for our Stroger. So taking a look at our Joint Commission window, our previous survey was June 4th through the 7th, 2024. And so we are currently preparing for our window, which will open in January 7th of 2027. Just a little bit of background, the bulk of our recommendations for improvement that were found in 2024 were in the moderate and limited and low limited categories. So we have provided the safer metrics, but certainly, you know, those are the area where you would want to be if you had any kind of recommendations for improvement. And so want to talk a little bit about our focus and our plan as we prepare for our 2027 survey. Next slide, please. So we have put here our Stroger prep plan, which includes about 10 of our goals as we plan to move forward. I'll just hit on a few of those. Bottom line is that we really want to stress to the entire Stroger leadership team the need to make sure that their areas are survey ready. So we will be doing a deep dive survey rounds in each of the areas, really touching every single location within Stroger. There'll be constant rounding that will happen on a weekly basis as we begin to start the rollout. They will have a tracer prep and chart audit with questions that'll kind of be a toolkit for the staff. We also will be looking at our national performance goals and providing a weekly checklist for the leaders to provide for really a self-assessment that can be done by each of the leaders in their areas. We'll be providing a Stroger quick tips as well as folders that can be kept in any of the clinical areas that really has kind of the do's and don'ts as well as some key items as we look at the 2027 areas of focus. So to the right in the box, we've kind of put a little bit of the focus points as we think about our prep. So again, we'll be reviewing our 2024 recommendations for improvement to really avoid any of the same issues coming up. We know that some of the things that continue to be a focus from the Joint Commission side are infection control standards, making sure we have consistency in our clinical areas. Anywhere that we're using an instrument for single use in terms of cleaning and disinfection, that the protocols and standards still remain to be in place. Looking at our temperatures, the refrigerators and our warmers, are we doing it consistently with the policy? Our pain assessment and reassessment in our clinical areas, as well as our post-anesthesia evals. So taking a look at, just wanted to share next slide, please. Just wanted to share the status of some of the upcoming surveys and some of the recent visits that we've had. We have a IDPH unannounced complaint visit that was scheduled back in April. We have submitted our plan of correction and we are waiting for a final resolution from IDPH, but we are confident that our plan has, continued to outline the things that they have highlighted. Also, we are waiting for the IDPH outpatient dialysis recertification. The window was actually open August through December of 2024, so we really expect them anytime. And again, this is for our outpatient dialysis, so we are ready for that. Also for the Commission on Cancer from the American College of Surgery, there was a virtual visit that took place April 21st of 2026, and we had one citation, and so they are submitting an appeal. Also, the IDPH EMS Resource Hospital survey will take place October 22nd of 2026. We have an IDPH, our perinatal redesignation, November 19th of 2026. The American College of Pathology, from August 25th to August 22nd is the window. This year, those certifications will be combined between the two hospitals. Normally, they're on a different cycle, and so, we're happy that that's going to be one survey. Also, and then lastly, obviously, our triennial survey that I talked about. And then lastly, we have a stroke intercycle phone call that's been scheduled, and that's sort of the halfway point for the stroke recertification survey. So again, we continue to focus on all of the accrediting bodies that will be joining us at Stroger. And let me pause to see if there's any questions.
Thank you for going through that. Yeah, are we changing any approach, or is there anything of note that you need input from this group on as it relates to the various accrediting bodies and topics they're addressing?
No, thank you for that question. We really feel confident that our approach of, really planning for, to meet with the leaders prior to the window is going to help us greatly. Excuse me. Also, we'll be doing we're planning to do a mock survey as well. But right at this time, we appreciate the question and the support from the board, and certainly we'll keep you updated as we move forward.
Committee, have any questions?
What was the issue with the cancer registry?
I can follow up with you. I don't recall. I have to take a look at that, but I'm happy to follow up with you.
There's no other questions or comments, so we'll go to Provident update.
Thank you.
Thank you.
Good morning. Dr. Arnold Turner, Chief Hospital Executive, Provident Hospital, Cook County. Good morning, Director. Good morning. I'm here to give you an update on regulatory for Provident. For the past 12 months, Provident has had several certifications or surveys by regulatory organizations. That include in June we had the Joint Commission Health Equity Accreditation that we did jointly with Stroger. In August last year, Provident Dialysis Center had the IDPH certification survey, which passed with very flying colors. We had this CAP survey in October, and this year we've had our echocardiography lab received a 3-year accreditation. Our mammography units passed the Mammography Quality Standards Act survey. Nuclear medicine passed the IEMA survey, and our food service department passed an IDPH inspection. But the main one that's coming up this year is our Triennial Joint Commission survey. The previous survey was in December of 2023, from December 5th through the 8th. It was a 3-day survey. We had a nurse, a physician, and engineer for the life safety, and also primary care medical home survey for our clinics. As Donica pointed out, the way the survey goes is that they go against the standards, grade us against the standards. As they find something that's non-compliant, they note it, and so they measure you both on the quantity of findings that you have, and also the severity, whether they're low, moderate, or high. And where you definitely want to stay out of is the immediate threat category, because if you have a finding in that area, the survey stops. We had, in our previous Joint Commission survey, we had 16 findings on the safer metrics, none in the high category in the red. Those are conditional findings. And when you have findings in that area, the Joint Commission comes back within 30 days. So most of ours, again, were in the low, limited, and moderate pattern categories. We entered the window for our triennial Joint Commission survey officially as of June 8th of this month. In order to prepare for this survey, we did have we retained the services of Kissinger Hospital Accreditation Consultants for a mock survey, which we had on May 18th through the 20th. We did reasonably well as far as of the 742 EPs that we were graded against, we had only 27 findings, which was 96%. But of those elements of performance, were graded. So we did have some in the red category, the orange category, and yellow categories on the safer metrics. So we do have some work to do, because we definitely don't want to have any conditional findings. I must say that the mock surveys were very thorough. Mitchell Kissinger, who was on the clinical side, he currently serves as a Joint Commission advisor. And the facility surveyor has participated in writing some of the standards for the Joint Commission. So it was a 3-day survey, 3 days for the clinical survey and 2 days for the environmental survey. There were a total of 27 findings, and some of the areas that were cited are listed on the slide there: physical environment, infection control, leadership, medication management, national performance goals, nursing and provisional care. Some of the opportunities for improvement are listed on the right there. And some of those findings were found to be not just limited to one department that's listed there, as far as staff knowing how to get a patient out of a bathroom if they needed assistance. Another one was following the instructions for use for equipment as far as maintenance and checking. And so we have put steps in place to help us prepare for our upcoming survey. Next slide, please.
Would you say, as a question on the cited with findings and points, would you put these in the moderate category that you referenced?
I'm sorry, could you repeat that, please?
So on this slide, the cited with findings in the following standards, would those be considered in the moderate bucket in the previous slide?
The ones up there on the right?
Yeah.
Some were in the moderate and some were in the red.
Okay.
Next slide, please. So to prepare for this, we have put a number of things in place. Some that were already in place were our preparedness rounds that are weekly. We're doing weekly tracers, but we changed our meetings from biweekly to weekly to really focus on those areas to make sure that we have everything, not only correct them, but we maintain the action items that we put in place to turn those things from red to no color at all. So we rolled out the national performance goal posters in all the departments. We provided the managers weekly sweep checklists so they can have an ongoing self-assessment of their departments. Quality department has provided us with weekly quick tips for the Joint Commission standards, and we discussed those in our huddle. Managers were provided with red folders that are basically a guide for preparing for the Joint Commission survey. And we also included chart audits, and we created a bin for the Joint Commission documents that we have to have at the time of the survey so that we're ready for those. Some of the challenges we have are staffing inconsistency, data turnaround times, and some of the process variation departments. We're standardizing those to make sure that all departments are processed where we can, following action items in a similar pattern so that we're aware of what they're doing. Are there any questions?
I have a quick question about leadership that you listed, one of the cited findings. What does it even mean, leadership? And also, you know, if you want to like actually improve leadership, that's not going to be like, what are these action items? What do you think that was?
Well, under those elements of performance were assigned to the leadership based on that they were responsible for. That's, for an example, one was not having expired equipment, and that was because the leadership should make sure that that's being accounted for. Another one was following, checking the equipment as indicated in the IFU. Again, that's a leadership responsibility. Things like that, making sure any contracted services are following their quality metrics, and that's a leadership responsibility.
And I think, as Joseph said, if there are specifics they want to get into, we can follow that up so we have more information, around some of this. And then just to reiterate, this is preparedness-oriented work, so we're preparing for surveys that are forthcoming. So that I think is good to go through these various exercises.
Do you anticipate being able to conduct a secondary mock review to see what the improvements have been since your initial uncovering of some of the moderate or red areas?
We don't plan to conduct another mock survey, but the consultant that we have, in addition to them coming, we have additional consultative services that we can do virtually if that's fair, a total of 12 hours worth.
So you can follow up?
So we can have follow-up.
Okay, good. You want to be able to have that to see where you can see those improved spaces.
Right, and if we have any questions as far as being compliant with any standards, we can consult them also.
Let us know if we can help with anything.
Sure.
Okay.
Will do.
Thank you, Director Sorrell, Director Kim, Director Harrington. Good. Okay. The only other thing I'd say is just thank you for all. Did you have anything else? No. Just thank you for all the work, the quality safety experience, regulatory team, and the preparedness work here. I think is really important. And a little show and tell if both back to our strategic plan for the county around quality, safety, experience. This work maps to the tactics and the key metrics we're driving towards. So that's also important. So appreciate all the work on preparing for these.
Thank you.
Thank you. All right, we have the ACHN regulatory update.
Good morning, Cherie Boyd, Chief Operating Officer for ACHN. So what's going well with our accreditation? We did a mock survey at the Provident campus for our ambulatory services. Some key highlights: 99% of our standards was compliant. Out of 16 Joint Commission chapters, 5 standards were non-compliant. 9 observations were cited out of 742 standards. 22 out of 25 quality tracers were completed, and by June 30th, we will have met 100% compliance. 21 out of 23 primary and specialty sites completed their monthly Joint Commission tracer. Next slide, please. Our current challenges and projects that we have in place are, procedure instrument trainings that included, instrument pre-cleaning, handling, and transport and storage. Patient self-management goals, we focused on diabetic patients, so all of our primary care staff were trained on the updated workflow, new patient forms, and documentation for every patient's visit. External referral management, we started a project to decrease our external referral process and increase access and track all of our external referrals. And medication refrigerators, we needed to make sure that we're documenting daily temps after weekend and after holidays to maintain our medication integrity. Clinic checklist included checking supplies for expiration dates, monthly staff needing to administer medications and eye drops per provider orders and follow the manufacturer instructions for use. End of my report. Any questions?
Thank you so much. Any questions for committee?
Thank you.
Thank you. Go to Cermak Health Services
Manny is remote.
and Manny.
Good morning. Yes, I apologize. This is Manny Estrada. I'm on Teams. I apologize for being virtual. We had just some issues here in the facility related to the storm we had last night.
Thank you.
Good morning.
Good morning.
Good morning.
So on to our work related to our quality update and our regulatory activity. So just so some of the work that we're doing now is aligning our quality program to correspond with the CCH level plan, system level plan. We've always done some the quality work here necessary to do and meet the accreditation standards, but we're ensuring that we're aligning to the systems plan. A lot of work that we've been doing with our Director of Quality, Kevin Hickey, and the system team. In preparation for the upcoming survey, which we are in the window of prepping for, we've realigned the 90+ CERMAC specific policies to correspond directly with the accreditation standards. The standards have become a little bit more stringent as it relates to policy, and they have specificity that needs to be incorporated. So we've done all the work to ensure that that's done, and additionally, making sure that we have the policies up and available for staff to be trained on and be able to access as appropriate. We're also training our staff to use the cause mapping or root cause analysis when we have any events that need to be reviewed here at the jail. We do have some sentinel events, or what we classify as sentinel events, that have an obligatory component for us to do a root cause analysis. The unique aspect of our analysis is that it not only incorporates the clinical review, but it also incorporates what's called an administrative review, which aligns with our team and the Department of Corrections team doing a dual review to ensure that we're crossing the intersect of safety and security and patient care. Those are very intensive and very detailed. And ultimately, the goal is to find the root of where the intersect is or where there are opportunities. Next slide, please. This is the activity that we related to accreditation. We are actively in waiting mode. Our jail standards accreditation with the National Commission on Correctional Healthcare is scheduled for next week, or the week June 23rd through the 26th. We are in prep mode. It's all hands. We have a team of 5 surveyors coming on. They will be looking at all standards across the newly revised jail standards. There are 59 standards with 400+ compliance indicators and approximately 300 supporting survey documents that we're prepared for and are looking forward to the accreditation team. We had a mock survey conducted here at CERMAC about a quarter ago, where we had some of our colleagues, subject matter experts in the world of corrections health, that were able to tour the facility, assess our preparedness for it, gave us a positive review on that survey. We're confident that we'll be well prepared for the upcoming survey. It is a reaccreditation survey. Our first accreditation was in 2023. It is a 3-year cycle. I'll just share the history. It was our first accreditation cycle going back about a decade. Did the work of getting us to a place in the time where we were prepared and met all the requirements in the previous accreditation cycle. We believe again that we'll be prepared. We are prepared and we'll have a positive outcome from the accreditation survey itself. The Juvenile Detention Center went through their jail standard accreditation cycle last year, so they were fully accredited at 100% compliance. We expect similar results for us. The second accreditation initiative that we have is our opioid treatment program. The accreditation cycle is also 3 years. We at CIRMEC have the only opioid treatment program accredited in a correctional facility in the state of Illinois. Went through our cycle last year and we're reaccredited in 2028. We're really proud of the work that we do in the SUD opioid treatment program world. Essentially what it is that patients that enter the facility that are in the program, in the community, are continued in that program. We other facilities historically have detox patients, which is a very physically and emotionally demanding and challenging situation for our patients to be. Our accreditation has been here in place for the opioid treatment program for over a decade, and it's nationally recognized for the work that's being done around the OTP program. The final accreditation initiative that we have, and this is a newly created accreditation opportunity with the National Commission on Correctional Healthcare, is our mental health services accreditation. Both juvenile detention and CIRMEC will be and have petitioned for accreditation in this standard. We expect, based on NCCHC's availability, to be accredited, to be surveyed either late fourth quarter in 2026 or early first quarter in 2027. The standards for mental health have also been recently revised, and our requirement will be to be able to demonstrate compliance with 100% of the standards that are in place. Again, we're confident that we're positioned well based on the preparation that we have for the regular jail standards and some of the work that we've been doing surrounding behavioral health, mental health, both here at juvenile detention. We have one of the most robust programs in corrections in the state of Illinois, absolutely, but across the country we have a really robust program both at juvenile and at the CIRMEC Health Services. Again, we're proud of the work that we're doing here. The accreditation for us, if all three are achieved, positions the organization to be recipients of what's called the Pinnacle Award with NCCHC. That is receiving all three accreditation for the available lines. Very few organizations in the country have achieved this level of prestige, and we expect that we will be among that group of colleagues and hopefully reporting out that next year. I'll open up to any questions and or comments.
Any comments, questions? Thanks for all the work on these different areas.
Very much.
Or County Department of Public Health.
Thanks so much, Chair. Good morning, directors. So I wanted to share an update here for CCPH's accreditation process, and starting out with a little bit of background for you all. I think some of you are likely familiar, some of you may not be. So I wanted to start out with just a contrast between the Joint Commission process and the Public Health Accreditation Board process, which, as you will see, is somewhat newer and has a slightly different approach and methodology. So obviously, based on the name and based on I'm sitting here talking about it, FAB accreditation really focuses on governmental public health entities at the state, territorial, tribal, and local level. The goals of FAB accreditation are really to improve public health infrastructure and ultimately drive population health outcomes. And so if one were to say, like, review at some of the standards and measures that FAB has, if you had done work in public health, you would probably find yourself nodding along to them, because they're essentially good public health practice. They represent good management practice, I would say. Another way that they differ is in the methodology. So those of you that are familiar with Joint Commission are likely familiar with tracers, where a FAB, or rather a Joint Commission surveyor, may go through and follow a patient through the care process. The methodology for FAB is very different in that it's more about ensuring that the health department is developing plans, processes, and the related documents that support their work and that they're implementing those plans. So it's not just a plan that sits on a shelf. One example of that is the community health assessment and improvement plan that we presented to this body, rather to the larger board a few weeks ago. And I think what's really critical to demonstrate to our accrediting body is that we're going to move forward and implement this plan, that it's going to drive our work in a meaningful way. Next slide. So again, just a little bit of background here. FAB originated in the 2000s, and CCDPH was initially accredited back in 2014, just as I was starting at the health department. So I missed that first round. We did go through a successful round of reaccreditation in 2021 that my co-lead at the time, Dr. Rachel Rubin, had led, and we are now going for reaccreditation yet again this year. There's a little bit of a delay there in 2021. I think that was largely because of the pandemic, but essentially it's on a 5-year cycle. And so you can see here that really it's about foundationally promoting performance and continuous quality improvement. And so I think it's actually really helpful to us from the accreditation perspective that we're engaged in this meeting here today. So just wanted to thank my colleagues in the quality team for doing that. Next slide.
Thank you to the team, and this is critical work. The other thing is FAB has a new leader that started 18 months ago, who comes from the state health department kind of arena, so is familiar with the importance of this, this kind of system that applies to Cook County. Thank you. Next slide, you'll see this colorful sort of pinwheel, and I always like to say, public health always struggles to communicate what we do, so we're really fond of making lists. This is essentially a list of our 10 essential functions. I'm not going to go through them. They just give you a sense, a flavor for what some of the domains that compose FAB are made up of. So you'll see quality improvement is definitely one of our essential functions, as is infrastructure, workforce, and the like. Next slide. So again, this meeting is timely because we're coming up on submitting all the plans, the processes, and evidence of implementation to FAB. There's a bit of a typo there that says we're here November 2026. We will be there in a few months, and we're very close to closing out all the documents and submitting them to FAB. So once we submit our documents in November, FAB will review that documentation, conduct a site visit and some interviews. My experience with this is somewhat skewed because it was mid-pandemic, and the interview was essentially virtual. I suspect that they'll come on site for this round. And then once that's all completed, we'll hear back from them about our status, and I fully anticipate that we're going to be accredited without any issues. Next slide. So I just want to close out by saying that we are very much on track for reaccreditation. We've collected 88% of the documentation that we need for reaccreditation. I think the final piece of the puzzle there, that last 12%, was really that community health assessment and improvement plan. So with that now being approved by this body as well as the Cook County Board of Commissioners, I think we're very close to 100%. And so looking forward to the site visit and reporting back
on a successful reaccreditation at a following meeting. I do want to say that just looking ahead towards the next accreditation cycle, we've got some areas of focus. Obviously, I've mentioned implementing our community health improvement plan several times. We do also want to work on our emergency planning and response plans. We've had some really productive conversations about that in collaboration with some of the folks in CCH leadership, and also would be wanting to look at continuing to mature our performance management system in collaboration with my colleagues in the quality improvement team. Thanks. Happy to answer any questions you may have.
Any comments, questions? A lot of both on CIRMAC and this various documents and standards to review and address. So thanks for all the hard work.
Thanks so much. Again, want to acknowledge the partnership. Also want to acknowledge Nandini Roy Tayabali, who's our manager of organizational performance and accreditation.
Dr. Joshi, you may not know this. Quick question, and we can follow up on, but on the domains and standards of Central Public Health Services framework, they have equity at the center, but then equity also as a area.
I think that's a typo. I caught that earlier.
Okay.
Yeah. Thanks. It's at the center.
Yeah.
Appreciate it.
County Care.
Yes.
Very
Good morning.
morning.
My name is Christy Torino. I'm the Chief Operating Officer for County Care Health Plan. Looking forward to providing you an update on our accreditation with the National Committee for Quality Assurance. Today is a very exciting day because we are going to be clicking submit for our desk review for our 3-year accreditation. So every 3 years, we go through an accreditation process with NCQA that sets the standards for health plans. Our look back period was from June 1st, 2024 to May 31st of 2026. And so we actually put together documentation for those 2 look back periods to demonstrate that we were in compliance over that period of time. We are also going to be clicking submit on a new distinction, which is for long-term services and support. So these are the standards for how we as a health plan support our about 10,000 members to be able to stay in the community or receive support from long-term care. Since this is our first survey, the look back period was a little bit shorter. It was from December 30th through June 30th of 2026. And that's kind of an add-on to our 3-year accreditation. So moving forward, that will be on a 3-year cycle. We also are going to be, we have applied for the Health Outcomes Accreditation. This is formerly the Health Equity Accreditation through NCQA. They updated the name at the beginning of this year. This is the first time that we're going through that survey, and that's really been led by our accreditation team, as well as our Director of Health Equity, Cindy San Miguel, who was here last month, and we'll be submitting that at the end of this month. So on the next slide, so there are lots of different reports that go into our accreditations. We have to demonstrate that we have interactive programs like our food care program or Brighter Beginnings, which is our program for maternal and child health. We also presented and received approval, thanks to this committee, for our cultural humility and cultural and linguistic appropriate services and that program description last month. So that's just a couple of examples of the types of reports that are required for these accreditations. We have over 600 pieces of annotated evidence that will be submitted, including policies and procedures, other materials. And as I mentioned, the 2 new there's one new accreditation, which is the Health Outcomes Accreditation, and the new distinction for LTSS. So that just underscores the importance that we have for rigorous quality of care standards, health equity. And then on the next slide, oh yes, Director Harrington.
What is cultural humility?
So cultural humility, it's a little bit of a shift from cultural competency. So cultural competency makes it seem as if you could become competent in being able to address and support people with, and cultural humility is a lifelong learning. So the idea is that over time, you are working to learn and be a lifelong learner in providing culturally linguistic and appropriate services to your members.
And there's objective criteria that you can use to establish if that's occurring.
So we do regular training on cultural humility. It's actually, it's called cultural competency within our contract, but we do training for our team members. I don't know that there's a, something that says, yes, every team member is going to be free of committing some kind of implicit bias or something like that, but it's something that you're constantly working towards. Something else that we do is built into our team meetings, kind of like a health equity spotlight where our health equity director brings messages and reminders and things like that. So it's something that our team is working on over time. And then on the next slide, so for our health plan accreditation and LTSS distinction, as I mentioned, we'll be submitting those today. We have a complex case management file review that will be occurring over 2 days. That'll be on August 3rd and 4th. And we are also submitting the universe for that today, getting back the sample, and then we'll be prepping all of those cases to be able to be prepared for that on-site survey. That the same goes for the LTSS distinction. This is the first time we'll be doing a file review for LTSS. And then for the health outcomes accreditation, there's no on-site. There is an opportunity for all 3 accreditations to complete remediation within the desk review, and then we'll be receiving final decisions in September. So some key challenge areas that we're just looking out for is just the short timeframes to complete any needed remediation, and also prep our files for the complex case management file review. That being said, I have every confidence that our team will be prepared in support of those upcoming deliverables, and they've been doing just an amazing job getting everything ready, really over the last 3 years, but especially over the last several months. Any questions?
Question, comment?
Congratulations on being able to submit things today. It was interesting to see the cultural humility and review that you did last month. So, in taking from that, we'll be wishing the best for the upcoming months.
Oh, thank you
It's going to be
so
an
much.
exciting time for you.
Yes, definitely. Thank you. We appreciate it. And we'll be happy to come back and share the results. It's been a very exciting week because we also received notice that we got another contract for Health Choice Illinois. So lots going on this week, but really appreciate your support.
Thank you. I was gonna lift that up, and congratulations on the contract and submission. And again, it's in here that it's one of our strategies in the plan, so we're making progress there. But I just want to also to say collectively, not to the whole system and the team working on it that presented today, just give them a round of applause for preparation is critically important to being successful as we move forward and deliver on our mission and strategy. So, thank you.
Thank you.
All right, we'll the committee will now go into a closed meeting. So actions not expected to be taken in open session. After discussion in closed session, I have a motion to go into closed meeting pursuant to the following exceptions to the Open Meetings Act, 5 LCS 120/2, 1-11-17. Roll call vote. We have a motion to go into closed session.
So moved.
Seconded. Any discussion? All in favor, say aye. Or sorry, roll call vote.
Roll call vote on the motion to go into closed session, aye or nay. Director Kim? Aye. Director Sorrell?
Aye.
Director Staines absent. Chair Bott?
Aye.
It's 3 yeas and 1 absent.
So, roll call vote passed to go into closed session. Following the roll call vote, we'll recess here. We'll recess in a closed meeting. So a few minutes, we need to clear the room.
So the only people that should remain in the room are Dr. Smith